Today I want to raise the issue of the Autism Protocol, which was brought to Cabinet by the Minister for Disability and the Minister for Health this morning. And as a former member of the Autism Committee in the last government term and a member currently of the all-party parliamentary group on autism, I just want to get more clarity on exactly what this is. So I think they're launching it today with the HSE, and it's a new autism assessment process for children and adults. So I welcome anything that will address the significant backlog in AON for children. I think we're approaching 22,000 at the moment, and there's no current public method of adults being assessed. So I welcome that as well. But on reading up about it, I'm coming across some conflicting pieces of evidence. So in one place it's saying this will replace the current AON process. But in another, it's saying, importantly, these changes will not remove any rights for a person to apply for assessment of need for their child, nor would they alter the statutory 6-month timeline set out in the Disability Act. So I just want to know how those two marry together. It's saying that assessment officers will be supported by 11 new teams throughout the country, comprising 4 on each team. Now, there's going to be a psychologist, a speech and language therapist, an occupational therapist and an administrator. At the moment, CDNT teams, primary care are under extreme pressure for staff, and the staff they're under pressure for are psychologists, are speech and language therapists, are occupational therapists. So where are those positions going to be filled from? Are we going to be taking from existing teams to fill these positions? The problem with the current teams and the primary care teams indeed is that there aren't sufficient staff to deal with the level of demand. So we are seeing, more and more children waiting for assessments or waiting for services because of the lack of staff. And a few years ago, the early intervention teams and the child development teams were replaced by the CDNT teams, and it ended up with children being missed and falling through the cracks and not being on any list for services. It's also said there's an introduction of an additional management grade overseeing the assessment of needs. I mean, the last thing we need is more bureaucracy and more managers within the HSE. We need frontline staff, absolutely, within these teams or within our acute hospitals, but we don't need more managerial grades. So I want to ensure that these teams will work to address the backlog, because I'm reading as well that children do not need an assessment of need report to get access to services. But what I'm finding is that children are not getting services without the assessment of need. They're not getting into special schools or special classes without the assessment of need. So how is all of that going to be addressed? And even those children who have the assessment of need carried out are not getting the services. So I would welcome a more in-depth discussion on this protocol. Thank you.